What is a permanency rating, and how do I get one? I am asked that every single month. Having represented injured and disabled people for 30 years now, I am not surprised when I'm asked, what is a permanency rating, Mr. Landau? Or what does my doctor mean by a permanent partial disability rating? A permanent partial disability rating, or PPD rating for those who use abbreviations, is simply a numerical rating, usually a percentage rating, assigned for a loss of a part of the body or the use of part of the body. For example, if I were to lose my ring finger on my right hand in a paper cutting machine accident at work, I would likely receive a 100% permanency rating from my doctor for that finger. In other words, I have no ring finger, that's a 100% loss. It might be only a 17% loss of the hand, and it might be only a 3 or 4% loss of the arm, and maybe only a 1% loss to the whole body. In other words, you can have several permanency ratings for the same injury, but you can only get benefits for one of those ratings. Different states allow different values for different parts of the body. So make sure that your lawyer is experienced in handling these cases and knows what those numbers are. For example, in Virginia, the complete loss of an arm is worth 200 weeks. In other words, if my arm was taken completely off, amputated, and completely gone, and I went back to work the next day and didn't miss a single hour of work, I could receive a compensation check for 200 consecutive weeks, about 4 years. It may seem a bit morbid, and I actually think it is, but the legislators in every state have given values for every part of the body that is used in work. So there's a rating for loss of arms, legs, hands, toes. There's ratings for loss of vision and hearing. However, some states allow for whole body ratings. Just like in my earlier example where I had 100% loss of the finger, was only 1 or 2% loss of the body. Other states do not allow for a whole body rating. Virginia does not accept ratings to the whole body. If your doctor is giving you a rating of 12% to the whole person, that has no meaning to a Virginia workers' compensation judge. Likewise, Virginia does not accept ratings for the back, neck, spine, head, or whole body. They do allow ratings for scarring or severe marked disfigurement up to 60 weeks, but that is something generally a judge has to see in person in order to evaluate for that sort of rating. It's a subjective standard in some measure. How do doctors come up with these numbers? Do they have a Ouija board? Do they roll some dice? Is there an abacus or some other device that they use? No. Doctors like orthopedic surgeons, like neurosurgeons, like your general physician or internal medicine doctor will go to the AMA guidelines. That's the American Medical Association. They print a book periodically that has measurements that help doctors look at the objective injury to come up with a permanency rating. The 4 main criteria are range of motion. That is, if before the accident you could raise your arm up to your ear, and now you can only raise it half that distance, the doctor measuring this would say that you have lost 50% of the range of motion for that particular joint. Number 2, they look at strength. If before an accident to your arm you could lift 50 pounds this way, and now you can only lift 25 pounds, the doctor may find that you've lost 50% or half of the strength of that particular joint or muscle unit. In addition to range of motion and strength, another thing that the doctors look for is sensation. Some of you have a doctor use a pin-prick wheel or testing of your skin to see if you feel or don't feel certain sensations, and a loss of sensation may count towards the ultimate permanency rating. Lastly, another component is pain. If there is pain in the joint or pain in the limb affected, that may also cause the doctor to give an additional rating. Generally, though, under the AMA guidelines, they're looking for objective medical criteria that can be replicated or repeated by other doctors. In other words, under the AMA guideline book, 3 different orthopedic doctors should come up with the same exact number for the same injury to the same person. The AMA 6th edition is very, very hard on the injured worker because the numbers that are given for injuries is very low. So sometimes we will ask doctors to look at the injury and evaluate under the 4th or 5th edition, since the 6th came out before it was fully completed. And with the 6th edition, there is a 50-page plus addenda that most doctors don't know about or use, so it's fraught with problems. Under the 4th or 5th edition is acceptable under the Virginia law for workers' compensation for a permanent partial disability rating. Once you get a permanent partial disability rating, for example, to the arm, you can't then also get a scarring rating to the same arm. In order to give a permanent partial disability rating, a treating doctor has to make several findings. 1, that there is a permanent partial disability to be rated. Number 2, that the patient, after a terrible accident that's brought down their health, has recovered and reached what's called maximum medical improvement. It's like a plateau. And number 3, that this permanent injury is as a result of the on-the-job accident or a car crash or dog attack or trip and fall or whatever the cause of the injury was. So they need to find causation, maximum medical improvement, and have a numerical rating. If someone is about to have surgery in a week or a month, it may not be right for a permanent partial disability rating. Likewise, in many fracture or broken arm and leg cases, the doctors like to wait 3, 6, 9 months or more before they will give a rating because they want to allow for healing. Different people heal at different rates. But if you have had a permanent injury and your doctor has said you're going to have permanency or a permanent partial disability rating, you want to get an experienced injury lawyer to help you recover benefits for that permanent loss.